Good morning. We will see in this video types of insulin. Insulin is issued from genetic engineering. Schematically, we have human insulin and insulin analogs. For human insulin, its molecular structure is identical to the one naturally produced or secreted by the human pancreas. There is several formulation. We have those with insulin and zinc. We might have also protamines. For insulin analogs, it is the same structure, molecular structure, but we have different one or more different amino acids. So we have different kinetics and solubility of insulin. For human insulin, we have short-acting insulin, intermediate-acting insulin, and mixed insulin. For insulin analogs, we could have also ultra-rapid-acting insulin and rapid-acting insulin, long-acting insulin instead of intermediate-acting insulin. We have also mixed insulin, but we have also co-formulation. We administer insulin generally subcutaneous, except for human rapid-acting insulin, we could do the injection subcutaneous or give it intramuscular or intravenous. For the oral administration, it is prohibited because there is destruction by proteolytic enzymes in the digestive juice. So the insulin is destroyed by when we take it orally. For the rapid-acting insulin, for insulin analogs, of course, we could use it also in the insulin pumps. We could not use human insulin or long or mix it down in the insulin pumps. We'll start with rapid or short-acting insulin. For human insulin, when we administer the short-acting insulin, we need to administer it before 15 to 30 minutes before meals. Patient should take snacks between meals to avoid hypoglycemia. So the effect starts after 30 minutes, the duration up to 6 hours, and the peak effect is about 2 hours from the injection of insulin. At the opposite for insulin analogs, we could administer insulin rapid-acting insulin analog just when we start eating or just after the meal up to 15 minutes after finishing our meal. There is no systemic snacks because the risk of hypoglycemia is less. The effect start after 15 minutes, the duration up to 4 hours, and the peak effect is about 1 to 2 hours. Short or rapid acting insulin are insulin for meals. So we'll take 1, 2, 3 insulin bolus when we'll start eating. So up to 3 times per day. It depends from the type of diabetes. For example, patient with type 1 diabetes might take 3 times per day. For the insulin short or rapid acting insulin for type 2 diabetes, we can administer it 1, 2, or thrice. And of course, rapid-acting insulin or short-acting insulin should be administered to correct decompensation when it is ketoacidosis or hyperosmolar. In Tunisia, we have Actrapid Jocelyn Air for human insulin. So it is ampoule right here. It contains 10 milliliter and we have a concentration of insulin of 100 unit per milliliter. So this ampoule contains up to 1000 unit of insulin. It is available also for the other human insulin forms. For insulin analogs, we have Novorapid, insulin aspart, and insulin glulisine apidra solstar. We'll pass now to the intermediate and long-acting insulin. We'll start with the human insulin. So the administration is also 50 to 30 minutes before meals. For patient with type 1 diabetes, it is twice a day. For patient with type 2 diabetes mellitus, it could be administered once or twice a day. If we'll administer human insulin, intermediate human insulin twice per day, the schedule should be fixed. For example, the patient should administer it 8 a.m. and at 8 p.m. to avoid dose overlap. So the effect is 12 hours and the effect will start after 2 hours. For the insulin analog, we don't talk about intermediate acting, but long acting insulin. The injection is regardless of means. We should just fix an hour, for example, 10 p.m., but we are allowed with few types of insulin to administer it up to 3 hours after 10 p.m., for example. The onset is after 2 hours. There is minimal peak effect, and the duration on average 24 hours. It depends. It could go from 18 hours to 36 hours with few formulas. In Tunisia, for human insulin, we have insulatard and Insuline N. So this is the same principle. And for insulin analogs, we have all these. We have Lantus, Solostar, Glargine, and Semigli. All these three are insulin Glargine U100. It is 100 unit per milliliter, and we have 3 milliliter in these forms. So we have 300 milliliters per ampoule here or per pen. So every pen contains 300 milliliter, and we have 5 pens in Lantus and Semigli. For 2GO Solostar, it contains 300 unit per milliliter, so more concentrated, and the effect will take more than 24 hours regarding insulin glargine, up to 36 hours for the more concentrated insulin glargine U300. So this pen contains 450 units of insulin. For Levemir, Detemir, insulin Detemir or Levemir Flex pen, it depends from the dose, so the effect can go from 80 hours to 24 hours. We might take it twice a day in case of patient with type 1 diabetes mellitus. For Tresiba Flex Touch or insulin Degludec, it can go also to up to 36 hours. So for these three types, it can go from 20 to 24 hours with insulin, Glargine U300 and Tresiba or Digludec, up to 36 hours. With Levemir, it depends from the dose, from 80 to 24 hours, depending from the dose. In Tunisia, we don't have ultra-rapid insulin. We have instead rapid-acting insulin, Aspart, which is Novorapid, and Glulizine, which is Apidra. So the effect will be up to 4 hours. And we have short-acting insulin, which is human rapid insulin or human regular insulin, which have an effect up to 6 hours with a risk of hypoglycemia here. For intermediate acting insulin, its effect up to 12 hours. And we have a risk of hypoglycemia more elevated than other analogs, long-acting analogs. So we have Detemir, its effect, as I said before, from 80 hours to 24 hours depending from the dose. For long-acting insulin glargine U100, the effect can go from 20 to 24 hours. And with ultra-long-acting insulin, which is Degludec, Tresiba, and U300 glargine, which is Toujeo, the effect up to 36 hours, and we have more stable absorption, so less risk of hypoglycemia comparing to other type of insulin. For the mixed insulin and co-formulation, we have mixed insulin, the human insulin. For every mixed formulation, we have 30% of short effect and intermediate or long effect in 700%. So for the mixed human insulin, we could administer it in once a day, twice a day, depending from the type of diabetes, and always before the meals. For insulin analogs, we have mixed B-aspart, so aspart is Novorapid, So we have like Novorapid in 30% and another aspart combined with protamine in 70%. So it has longer effect comparing to the aspart without being crystallized. So we have once, twice, 3 times per day we can administer Novamix, should be aspart up to 3 times per day, and it is not available in case of human insulin because the risk of hypoglycemia will be very elevated. For the co-formulation, we have aspart and degludec. Degludec, which is tresiba, take effect up to 36 hours. The administration could be done up to twice per day. So we have the combination of both effect like this. We have first secretion, so we have here first peak, and we have the effect for this case of human insulin. We have the intermediate effect up to 12 hours. So in Tunisia, we have Mixtar and Gislin 30. For insulin analogs, we have Novomix, which is B-aspart, here B-aspart, and we have Rhizodec, which is a combination of co-formulation between insulin aspart and insulin degludec, and we see that we have insulin in our body more than 24 hours in this case. For insulin vial, in Tunisia, we have the 3 types of human insulin contains in vials, and we have only glargine, which is long-acting insulin analog, insulin glargine, which is contained in a vial. We have 2 types of syringe. We have 500, we have 100 unit in this syringe, and we have 50 unit in this syringe. So every line in this syringe contains 2 units, and every line in this syringe contains 1 unit. The needle length is 8 millimeter here and 11 millimeter in this syringe. For insulin pen, we have this pen pre-filled. First, we will put the needle, which is sold apart from the pen. We'll put it here, right here, and we will verify with 1 to 2 unit of insulin that is permeable. Then we will select the right dose, for example, 10. We will put 10 here. We will move this until we have 10. Then we will push the button once we put the insulin in the subcutaneous. So we'll push it until it returns back to 0. We'll wait to 10 up to 20 until all insulin pass from the pen to our body. In Tunisia, we have 4, 5, 6, and 8 millimeter needles. With 4 and 5 millimeter needles, we can do the injection directly in the skin, the subcutaneous. And with 6, 8 millimeter needles, or with the syringe that we saw before for human insulin, we should do a skin fold before doing the injection of insulin.